family, and friends. Welcome to the 2021 10th Anniversary Fellowship Forum.
Thank you for joining us this evening as we celebrate the 10th anniversary of the Randall Lewis Health and Policy Fellowship. When we started 11 years ago, we had 3 fellows that represented one university. This year, we're so pleased that we can say we have 35 fellows representing 11 universities. This was an unusual year for us in many ways, and the fact that our forum is being presented virtually is just one more way that it has been unusual. But we're pleased that we can do it. We have 215 alumni when this year ends of fellows that represent the fellowship throughout the United States and around the world. You're going to hear today from a few of those on just what they're doing right now after graduating from the fellowship. You'll also have the opportunity to hear from each one of our fellows, and they'll take a few minutes to describe the projects that they participated in this year. We could not do the fellowship if it weren't for several organizations. One is the Southern California Association of Governments. They support us each year and help us to sponsor 15 of our fellows. We also have all of the sites and the universities that participate as well. Without the preceptors at each of the sites, we would not be able to do and provide such wonderful, rich opportunities for the fellows. Many of you know that each student has to complete not only a poster project, but a 2-page handout and a narrative at the end of each of their fellowship year. If you go to our website, you'll be able to see past students and their 2-page handouts. And sometime in the next couple of months, you'll get to see this year's students' projects as well. Dora and Randall had a vision 11 years ago, and we believe that we are continuing to work out into the community and support that vision that they had in providing students and fellows with public health backgrounds or interests, MHAs, MBAs, and data scientists, opportunities to work in the community and to push forward that positive thinking of public health into each of the areas that they are representing this year. So thank you very much for taking the time today to listen to the fellows and our former alumni. And we look forward to talking to you again in the future as we keep moving forward with our fellowship. Thank you very much.
"10 years ago, the fellowship began a bold vision for changing community health within cities by introducing public health fellows as part of the team. Over the years, 215 fellows have completed projects, which include safe routes to schools, community gardens, equity initiatives addressing greenhouse effects by planting trees, planning and implementing COVID vaccine outreach, developing affordable and sustainable housing plans, addressing transportation access issues, food deserts, and more. Over those 10 years, Randall Lewis has been a leader behind the scenes, supporting not only financially, but as a guide and mentor. Randall inspires the fellows by example that each one of them can make a difference. Thank you, Randall Lewis, for the fellowship, which is helping to guide future leaders in making our communities better. The Healthy Communities Movement isn't about incremental change or improvements that only focus on programs, behavior, or attitudes. It's a paradigm shift that involves engaging communities in a vision for a better and healthier future. This can't be described in a detailed plan, but in a common passion for creating community where we all have a purpose and a sense of belonging. Dora Barilla, President, Partners for Better Health.
Congratulations, fellows. Whether you chose it or not, 2020 and 2021 were really historic moments in public health. We want to thank you for your passion and the choice of public health and other health-related fields. 10 years ago, Randall Lewis and I started the Randall Lewis Health Policy Fellowship, really with the intent of developing our leaders that understood that we needed leaders of influence. We needed leaders that understood collaboration. It's not only about healthcare or public health or community-based organizations and communities of faith, but it's really about how do we work together. And so as we come out of the pandemic over this next year, many of us want to get back to normal, but I'd encourage us to think about a new normal, a normal that is more just and equitable. Thinking about a new normal for how we educate our children. How do we develop and create workforces that support women, that support families, that really think about how do we ensure that if something like this happens again, that we don't have the devastation, that we have a public health infrastructure that really supports communities, that we can adapt and pivot, and that we can work together to really address the challenges that we have in the future. And we know we have a lot of them. I pray that you all have encouragement as we move forward and thinking about the connectedness and all of the skills and capabilities that you've learned through each other, through the fellowship and through your program. In December of 2020, it was reported that over 181 public health leaders had either been fired, resigned, or were threatened out of office. And often this was due to them supporting a public health agenda versus a political agenda. And as we think about that new normal, we think about how can we have trusted messengers, consistent messaging based on science and compassion and not on a political agenda. The world needs you to understand and to be a part of that in our future as we move forward. So we want to thank you for being a part of the fellowship. We want to encourage you to continue to learn and grow, to be innovative, to think about what the world needs. Because what the world needs is your passion and your understanding of what it was to really be in a public health program or other health-related program in the midst of a pandemic. We want to encourage you to be the leaders that the future needs. We want to thank you and we want to offer our support for your success as you enter into the workforce in a new position or in your existing position with additional skill sets. We want to thank you and encourage you to be the light that the world needs today. All the best to you, and thank you for the opportunity to be a part of developing the future leaders.
A special message from our alumni.
When you want to take care of people, grow, and contribute to a healthier world, experience is the most profound and insightful teacher. Hello, everyone. I'm Laura Costa, and I was the 2013-2014 Fellow for Healthy San Bernardino, with Cynthia Luna as my preceptor. Under her leadership, she helped me understand that real change happens at the community level. I am proud to be part of the fellowship's 10-year anniversary. As a graduate of this esteemed program, my mind, my career, and my heart have been profoundly impacted. Thank you for helping me to become the leader I am today. Here's to you, and here's to the fellows of the future who are building healthier, more equitable, and inclusive communities.
Good afternoon, my name is Alyssa Kalunga, and I was a fellow in 2012-2013 with the Rim Mountain Communities. I'm very grateful for the opportunity the fellowship gave me to go into a community I've never been to before. I helped to create a needs assessment that was used to focus their services in future years. It also gave me the opportunity to work more closely with my preceptor and mentor, Mickey Carpenter. Congratulations to all of the fellows who are completing their fellowship this year.
Hi everyone, I'm Jeff. I was a Randall Lewis Fellow for the 2019-2020 period, and I'm so excited to hear everyone finish their posters. Hooray! But anyways, I was a Data Science Fellow at SCAG, and we got the opportunity to do a lot of cool things with telemedicine, GIS, and dwelled a little bit into COVID at the end of my tenure. And I'm really fortunate for all the opportunities this fellowship provided, the mentorship, the GIS workshops, being in downtown at the time, and getting able to use my poster as my MPH capstone. I'm definitely thankful for getting that county level governmental experience as a fellow, and for making new friends with other fellows along the way. So now I'm an epidemiologist, and it was definitely transferable to my current position at LA County. So yeah, that's basically it. And if you're mildly curious about epidemiology careers, let Jamie know, and I'm happy to connect with you guys and help you all out. Thank you again for inviting me. Have a great day and stay safe.
Hi, my name is Lindsay, and I'm an alumni of the Randall Lewis Fellowship. I completed the fellowship in 2015 while finishing up my master's in public health at USC. So the Randall Lewis Fellowship placed me at a regional transportation planning agency called the Southern California Association of Governments, or SCAG, it's a mouthful, where I was tasked with writing a white paper on the intersection of transportation, land use, and public health. I quickly started to see the connections about how our communities are planned, funded, and built, and how these decisions are made, how all of that affect our ability to live healthy lives. Everything from traffic safety and premature death to physical activity and chronic disease. I really started to see public health as intimately tied to transportation and land use. And I really just found my calling. And for that, I am so incredibly grateful for my experience at the fellowship. So, to the fellows finishing up their programs and looking ahead to the next step in their path, my advice is this: to follow your heart and what you feel called to do. Continue making connections and building relationships with people who are doing what you want to do. Remember that not every step in your path is easy. Some are setbacks or pauses that feel like you're being steered off course. Just keep looking for opportunities to get back on course. And mostly, have faith in yourself. Truly. If there is work that you feel called to do, I guarantee that your head and your heart and your energy are needed in that work. So good luck and congratulations on everything you've accomplished.
Introducing keynote speaker Colleen Flynn, Director of National Programs of Building Healthy Places.
Good afternoon. I'm Colleen Flynn, Director of National Programs for Build Healthy Places Network, and I'm thrilled to be here today to celebrate the Randall Lewis Health and Policy Fellowship graduates of 2020 and 2021. Congratulations to all the graduates. We've had the good fortune of hosting 2 fellows, thanks to Dora, founder and president of Partners for Better Health, and Janie, the executive director. This year, we've had the honor to work with Zachary Travis. He has been instrumental to our team, supporting our policy work to advance health and racial equity, and research with health payers to better understand how they're addressing the social determinants of health. The good news is we're hiring Zachary to serve as a research associate. We just couldn't let him go. Now a little bit about the network. We are a national center that transforms the way organizations work together across health, community development, and finance sectors to more effectively reduce poverty, advance racial equity, and improve health in neighborhoods across the US. Today, I'm here to talk with you about the future of public health. The increased awareness following the COVID pandemic of devastating racial inequities that impact health, wealth, and well-being provide us with a unique opportunity. There are increasing calls to recognize racism as a public health crisis. I've been reflecting on policies that perpetuate systems of racism, recognizing the harms done and limitations of healthcare and public health sectors, and how we can advance a national momentum for coordinated structural changes to more effectively tackle upstream measures needed across sectors. Nearly 1/5 of Americans live in historically marginalized communities that are prominently people of color, with fewer opportunities to achieve healthy and rewarding lives. Today, we know that factors related to health, employment, education, housing, and neighborhoods are linked. Place matters. And in many cases, your zip code is more important than your genetic code in determining your health. Our neighborhoods shape the opportunities we have, and those opportunities shape the choices open to us around our health and wealth. Since many of the root causes of poverty and poor health are the same, coordinated action between public health, healthcare, and community development is needed to increase investments that will support building communities where all people can live healthy and prosperous lives. The good news is that health systems and public health don't have to do it alone. The community development sector is a ready-made partner for public health, already investing $2 billion annually in high poverty neighborhoods to advance health and racial equity. So I believe public health will shift priorities and programs to address these inequities, bolstered by these cross-sector partnerships and supportive governments that invest in strengthening our nation's public health infrastructure. I think public health will pay more attention to who has decision-making power and how decisions are made to ensure BIPOC communities are the beneficiaries of community level improvements and that public health supports community-led projects and programs. I also think more health departments will collect and use disaggregated data. Information is power. The ability to identify specific areas of inequality depends on the availability of information generated from multiple data sources. The Robert Wood Johnson Foundation identified disaggregated data as one of the first principles of health equity for COVID response and recovery. Qualitative data representing the stories and experiences of communities facing inequities is critical to ensure the relevance of data-informed policy agenda. This process will also help build power in the community to create change through data collection and use. Hospitals and public health are uniquely positioned to create community health needs assessments and community health improvement plans with a constellation of neighborhood partners, including community development organizations, coalitions, and affordable housing developers that can specifically shift the focus of community health needs assessments and associated investments from disease management to community level health promotion. This approach can bring attention to the local root causes of poverty and poor health and set the stage for more effective community benefit resource allocations. Public health can advance anti-racism in laws, policy, and regulations to create community level conditions that support health and opportunity for everybody. I believe this is an exciting opportunity to partner and bring public health, community development, and healthcare together for concerted, coordinated effort to grapple with systematic racism. Thank you for your time and enjoy the graduation.
Our 2021 Fellowship graduates.
Hello, everyone. My name is Aaron Trezada, and I am a double master's student in psychology and evaluation and public health at Claremont Graduate University. I am currently a fellow at the Center for Health Equity, an agency through LA County Department of Public Health that focuses on racial, societal, environmental, and economic justice in relation to public health. My project at LA County specifically focuses on digital health disparities highlighted in the increased use of video conferencing applications during COVID-19. Although minoritized and underserved populations are more likely to be overlooked when it comes to outreach or distribution of resources, LA County hopes to increase digital community engagement by using the most user-friendly and efficient video conferencing application. The population I focus on are limited English proficiency, or LEP individuals, which account for more than 1/3 of the county's population and are more likely to suffer from health disparities compared to their native English-speaking counterparts. I surveyed more than 70 community-based organizations, specifically focusing on translation and interpretation services, and I also used a 6-part criteria to determine which video conferencing application was best. I found that Zoom was the most favored app because it was the most recognized, easy to access, and has a language translation feature that allows an administrator to assign translators and simultaneously play original content at a lower volume. This allows the participant to understand content better through tone, syntax, semantics, and other linguistic tools to improve understanding. The results of this project are currently being proposed to leaders in LA County Department of Public Health to use Zoom in place of its current application, Microsoft Teams, for future digital community outreach events and measure if there is an increase in community presence and participation. Thank you for listening.
Good afternoon, everyone. My name is Annabelle Lee, and I'm currently wrapping up my Master's in Healthcare Administration from Loma Linda University. As a Randall Lewis Health Policy Fellow, I was matched with the Rialto City Clerk's office to address food insecurity within the city. As we all know, health inequities are becoming increasingly prevalent and can lead to detrimental health outcomes. The City of Rialto is working to address these disparities by establishing Healthy Rialto. Healthy Rialto was established in 2008 as an initiative to enrich and empower the lives of Rialto residents. An aspect that addresses food insecurity is the Rialto Certified Farmers Market. Founded in 2012, the Rialto Certified Farmers Market provides the community with accessible and affordable healthy food options. Alongside the city recognizing the need for affordable, healthy foods, California began the Market Match program, which provides matching funds so that patrons are able to buy even more fruits and vegetables. As a result of the Market Match program, in conjunction with the farmers market, the total CalFresh distributed was $8,888, and total market match was $3,482 for the past year. In conjunction with the farmers market, the Rialto City Clerk's office has begun a social media campaign to highlight healthy, holistic habits and how they can be incorporated into our daily lifestyles. Also, we are currently working on creating a virtual walkathon to encourage residents to become more active. This program will enable us to partner with the Rialto Health and Fitness Center and other local businesses to provide prizes and free goodies. Throughout the course of my fellowship, I have learned about how local government functions, the importance of access to healthy, affordable food, and the intersectionality of government and public health. I know that the tools and skills that I have learned here will only enhance my professional career. Thank you so much for your time and listening to my presentation. Have a good day.
Hi, my name is Bridget Miranda, and I'm a nurse practitioner in San Diego, as well as a doctoral student at Azusa Pacific University in the DNP program. In collaboration with Randall Lewis Health Policy Fellowship, the Center for Better Beginnings, and Dr. Teresa Dodd-Butera, my project examined the relevant global, national, and local policies, as well as the professional practice guidelines that are already being established for maternal mental health. The focus was the impact of COVID-19 on postpartum depression and identifying strategies that would deter the long-term effects on mothers, infants, families, and communities. As you can see from my poster, nearly 20% of women suffered from postpartum depression globally prior to the pandemic, and 86% were being screened. However, during the pandemic, screening has decreased to 45%, and nearly 47% of women are suffering from postpartum depression. My proposed maternal mental health screening timeline is showing the importance of screening for postpartum depression throughout the continuum of care, starting from family planning moving on to prenatal and postpartum visits, and also during well child visits and any specialty care clinic visits that the woman or the child is receiving. During COVID-19, systems need to be scrutinized and programs need to be enhanced to increase the number of screenings, to also provide consistent and equitable coverage, increase funding for programs, as well as providing culturally competent education, procedures, and treatment. Thank you for listening.
Hi, I'm Chinyelo Ugwani, a DRPH Doctor of Public Health student at Claremont Graduate University in the School of Community and Global Health. I am also a Randall Lewis Health and Policy Fellow for the 2020 to 2021 cohort. I work for the city of Rancho Cucamonga in their Healthy RC initiative under the city manager's office. My preceptor is Hope Velarde. Healthy RC has been a successful city-community partnership since 2008, receiving national recognition for its work to improve community health. Healthy RC has many stakeholders working together to make Rancho Cucamonga the healthiest it can be. It has many programs. My program project was the Healthy RC Youth Leaders Annual Teen Summit, which due to COVID was made virtual. The Healthy RC third annual Teen Summit was a free event for all Chaffee Joint Union High School District teens. The theme this year was Build your best self, resilience, community, and future. The goal was to provide a safe space for high school age teens to come together to harness the power of storytelling and address difficult issues such as COVID-19 and its impact, social media pressures, identity, failure, mental health, LGBTQ issues, and racial and social equity, justice, and representation. The second goal was for the students to come together to participate in activities that provide tangible coping skills for teens to improve mental wellness. Ultimately, it was a success, even in its virtual format. We achieved our goals, and the city-community partnership worked as we showed the teens that representation matters and that their stories matter too. We thank our partners, Inland Empire Health Plan and Kaiser Permanente, for their support. The result has been a thriving initiative, meaningful community engagement, and a healthier community. Thank you.
My name is Christine Lee, and I'm a PhD candidate at Azusa Pacific University School of Nursing. My community site was Center for Better Beginnings. A policy analysis of maternal attachment in the COVID-19 was examined within the intersect of public health, policy, and nursing practice. Immediate physical contact after birth is essential to promote maternal-infant engagement. Suboptimal interactions can compromise infant development and attachment with serious long-term consequences. Given the expectations of high transmission and the risk of the dyad, hospitals enacted policies of maternal-infant separation in response to COVID-19. Health policy influences nursing practice through the intersection of systems, science, and society. Policies enacted during COVID-19 in the state of California, nationally and internationally, impacted the maternal-infant dyad. Attachment was examined within the constructs of bonding, skin-to-skin contact and breastfeeding, and social support within the visitation policies during COVID-19 pandemic. As you can see with the results, it demonstrated inconsistencies across guidelines, which resulted in variable care considerations around hospitalized women and the perinatal period, increasing attachment vulnerabilities. Health policy opportunities include the following. COVID-19 has highlighted the critical need for health policy to facilitate allocation of high quality, cost-effective healthcare services that protect and preserve the maternal-infant dyad. There is a need to further reframe the relationship between nursing, public health, and policymaking. and health policy expansion in breadth and depth needs to align implications of nursing practice and public health programs, address social determinants of health, integrate effective and efficient nursing practice and healthcare delivery systems regarding maternal child health.
Hello everyone, my name is Didhiti Dola. I'm a second-year Master of Public Health student at California State University, Los Angeles. I have been working as a Public Health Fellow at SCAG since last year fall under the Randall Lewis Health and Policy Fellowship. At SCAG, I have developed a Healthy Cities Toolbox, which is a resource that supports local planning or policy processes that identify and implement opportunities to advance plans, projects, programs, and policies to improve community health. The toolbox focuses on 7 public health focus areas and presents recommendations for local jurisdictions, public health stakeholders, advocates, and the general public. These recommended practices and approaches were identified through a review of the literature and recent planning activities. Proposed recommendations could be effective for addressing public health impacts, both across the region and within disadvantaged and vulnerable communities. Along with the Healthy Cities Toolbox report, an informational handout, PowerPoint slides, and a story map have been developed, which can be found on SCAG's website. This toolbox will continue to be updated on an ongoing basis to ensure the recommended practices and approaches remain appropriate. At the end, I would like to thank the Randall Lewis Health and Policy Fellowship for giving me the opportunity to work with SCAG, as well as my preceptor and colleagues at SCAG for providing me immense support throughout my work. Thank you all for your time.
Hi, my name is Diana Tran, and I am a second-year Master of Public Health student at California Baptist University. My site was Riverside University Health Systems Public Health with a focus on the built environment. Under the guidance of my preceptor, Miguel Vasquez, we developed a project revolving around communication and how it is a foundational component in developing healthy communities. Riverside County is currently ranked 52 out of 58 for counties in California when it comes to the built environment conducive to health. And so we developed these projects with this in mind. So I was a part of several different projects, the first being GIS mapping. We took a static Healthy Cities network map and put that into ArcGIS, making it more interactive. The map contained 28 cities, and the general public has access to be able to view what their city is currently working on for built environment plans. I was also a part of the Riverside County Healthy Cities Network newsletter. So I took this newsletter and put it on a new platform called MailChimp and was able to curate monthly content for it regarding healthy communities resources. I was also a part of the Josiah Avenue campaign, both on the social media side as well as the community outreach side in person, and was able to reach hundreds of Moreno Valley residents, informing them about the street changes that would affect their neighborhoods. I was also a part of the Planners for Health initiative, working on developing the annual summit, bringing together planners as well as public health advocates to open that discussion about developing healthier communities as well as health equity. So all these projects that I've been a part of has really emphasized the importance and necessity of communication and developing new ways to be able to bring together professionals as well as community members. Communication is really that very first step in opening discussion, bringing forth awareness, as well as influencing behavior change. These communication tools that I've been able to learn and develop during this fellowship, I plan to take and apply wherever I go and continue to fight for healthy communities as well as health equity. Thank you.
Hi, my name is Emily Beglarian. I'm a Master's of Public Health student at Claremont Graduate University, and I've held the position of Active Transportation Fellow at Southern California Association of Governments, or SCAG, for the last 6 months. My main project at SCAG has been working on the Active Transportation Database, or ATDB for short. The ATDB collects and stores active transportation data, such as bicycle and pedestrian data, within the SCAG region. Previously, most of the data in the database was point source data, meaning that it was collected once on a specific day or over the course of a few days, then uploaded to the database. Recently, the capabilities of the ATDB have been expanded to allow compatibility with permanent bicycle and pedestrian counters. These are counters that are set up in a specific place over the course of years and continuously and automatically count data each day. During my time at SCAG, I collaborated with a few agencies to gain access to their permanent counter information and import it into the ATDB. So not only did we gain access to years' worth of data, starting when the counters were installed, but now we can continuously gather this data into the ATDB moving forward. In total, I acquired over 15,000 days of bicycle and pedestrian data and imported it into the ATDB. This data can be used to observe trends over time, such as increases from one year to the next. It can also be used while considering the planning of active transportation projects, such as new bike lanes or expanded sidewalk access in certain regions.
Hello everyone, my name is Erica Park and I'm a current MPH and MS student from Claremont Graduate University. Today I will be discussing getting everyone to actively ride, or GEAR, from the city of Paris. The main purpose of GEAR is to promote active transportation throughout the city for all Paris residents. Our latest goal has been to expand the city's bike lanes in order to have more people using active transportation. Within the last few months, we've applied for 2 different grants, the first being from the Southern California Association of Governments, or SCAG, and the purpose of this grant was to expand our current bike lane situation and create a new bike lane on Orange Avenue. The second grant was a Community Development Block Grant, or CDBG, and the purpose of this grant was to connect the already established bike lanes in downtown Paris. Now, when choosing which roads we should promote for a new bike lane for these grants, we look at several demographic factors, as you can see in Figure 1. On the left, you can see a breakdown of the proportion of households who do not have access to a vehicle, and on the right are the median incomes of these households. So we look at these factors as well as other environmental factors when choosing roads that we should promote for a new bike lane. Figure 2 shows on the left the current bike lane status of Paris, and on the right you can see all the proposed bike lanes that the city would one day like to develop. Another aspect of GEAR is the social media and community outreach aspect. We are primarily using Instagram and feed and story posts in order to promote GEAR and educate the public as to how to safely ride a bike and use the bike lanes. We will also be using the Instagram to send out surveys asking the residents, are they using the bike lanes? Are they feeling safe on the bike lanes? And other questions to help us further develop GEAR. In conclusion, the overall goal of GEAR is to decrease obesity in the community, decrease air pollution, and increase access to resources such as schools, grocery stores, etc. In the future, we may also incorporate other aspects of active transportation, such as e-scooters, which are actually being researched today. In conclusion, I would like to thank the Randall Lewis Health Policy Fellowship and the City of Paris for this wonderful opportunity. Thank you.
Hi, my name is Haley Welch. I am a Master's of Public Policy student at the University of California, Riverside. Under the direction of the Randall Lewis Health Policy Fellowship, I worked with the City of Paris's Public Health Division. During my time at the City of Paris, I primarily focused on the Clearing the Air initiative. The Clearing the Air initiative is comprised of 2 separate components. One is an educational component and the second is a policy component. The educational component primarily focuses on educating the residents and the youth on the adverse health effects of secondhand smoke, along with the health effects of e-cigarettes and vapes. The policy component of the Clearing the Air initiative focused on banning smoking in multi-unit housing, such as apartments and condos, and also banning the use of couponing in the purchase of tobacco, and banning the sale of flavored tobacco within Paris' city limits. During my time here, this County of Riverside comprised a survey that they distributed to the residents of Paris, asking them the effects of secondhand smoke within their apartment complex and whether they found this to be an issue. 46% of respondents identified secondhand smoke to be an issue within their apartment complex. With a lot of alarming research that has come out on the effects of secondhand smoke that can be spread through ventilation, windows, it's really imperative that the City of Paris takes action towards protecting its residents and making sure they're breathing clean air. The second component focuses on the banning of flavored tobacco, which we know is mostly targeted at today's youth. During my time, I worked with the Youth Advisory Committee, which is comprised of high school students who work on educating their peers on the effects of secondhand smoke and tobacco and e-cigarettes. This initiative is imperative for the City of Paris for the residents to breathe cleaner air and to grow up in a city where their health is the main focus and the main priority of its city council. Thank you.
Hello, I am Ibrahim Kamil, the Randall Lewis Fellow at San Antonio Regional Hospital in Upland. I would love to share with you all my main projects. As COVID-19 disease was spreading in our community, we evaluated the morbidity and mortality reports, and we discovered that COVID-19 has disproportionately impacted the Spanish-speaking community in San Bernardino County. It was clear we needed to create an awareness campaign that shares important safety measures in both English and Spanish language to avoid any confusion or misinformation. Our awareness campaign evolved as we moved forward. Vaccines got approved and our message needed to be adjusted. Our message now is, it's not about you, it's not about me, it's about us. Get vaccinated. We reached out to community organizations and they were more than willing to share the materials we created to their members, making the distribution of the information both safe and effective. It was clear that community organizations, partners, are willing to help improve the community health, but communication between the organizations was limited. It was hard reaching each organization individually. So my recommendation is to create a task force to optimize communication between different community organizations so information is shared effectively and accurately to all the community members. Thank you all for your time, and please feel free to view my poster. Thank you again.
Hi, my name is Arina Krivenko. I'm an MHA student at the University of La Verne, and my fellowship site was the Randall Lewis Center for Wellbeing and Research. Did you know that almost 73% of students living with a mental health condition experience a mental health crisis on campus? Stigma is a set of negative beliefs that a society, a group of people have about a particular issue, such as mental health challenges. Also, it is number one reason students do not seek help. In collaboration with the Lewis Center for Wellbeing and Research, Office of Student Life and Student Outreach and Support, University of La Verne has launched Stigma-Free ULV campaign in order to break the negative perception of UM mental health and mental health illness as a weakness. Stigma-Free campaign intends to inspire students and faculty to share their stories of personal struggles to break the negative boundaries of existing stigma surrounding mental health. The campaign has two parts. One is to encourage participation in different programs offered by the Lewis Center, but the other message is simply to let students know that it's okay to struggle. Stigma-Free campaign aims to incentivize any program supporting mental health and social support. Every time a student participates in a Stigma-Free, he or she enters into a raffle for a monthly prize. Using Campus Labs to track the program, the early data indicates the Stigma-Free ULV campaign is on track to gain awareness among the University of La Verne students with events such as Mental Health Mondays, presented by the Lewis Center, and counseling and psychological services directed towards students who struggle during these challenging times.
Hello everyone, my name is Jacqueline Nguyen. I'm a graduate student at the University of La Verne in the Master of Health Administration program. Thank you for this opportunity to express my passion and career interest in working for Ativance Health Simi Valley, as I am assigned to this site. My goals for the duration of this fellowship was to integrate into the Community Health Improvement Strategy work plan, developing logic models for specific strategies and actions identified in the CHIS. I believe in preventive health and that a holistic healthcare delivery system can help to provide superior service and overall value for stakeholders in a patient care capacity. Through my assignment for Ativance Health Simi Valley, I accomplished one of many assignments. Through my assignment with Ativance Health Simi Valley, I am most proud of the Caregiver Educational Tools project that I accomplished. These educational tools help caregivers' relationships with the underlying patients, which affected their health outcomes by ensuring preventive measures can be taken into patient care capacity. Thank you for watching, and please let me know if you have any questions.
Hi everyone, my name is Yamila Cervantes. I'm currently a Master's of Public Health student at Cal State LA. I had the honor and privilege of working at the Community Information Center at Adventist Health White Memorial. Under the vision of Director of Community Wellbeing, Rosa Navas, and her incredible staff, The Community Information Center continues to transform to carry out Adventist Health's mission of living God's love by inspiring health, wholeness, and hope. Most recently, this has looked like the adoption and formal recognition of the Food Security Program. At the start of my fellowship, very little was known about the recipients of the Food Security Program. So I adapted material to develop a survey. I gathered feedback from staff on the survey, translated the material into both English and Spanish, and administered it in paper form to 217 participants on 3 different distribution days. Data from 212 surveys was analyzed using SPSS and Microsoft Excel to create the results that you see on my poster. In my opinion, the most important findings can be found on the right-hand column of my poster, which focuses on systems data. An additional project that I worked on during my time there was to develop the mission statement, goals, and objectives of the Food Security Program. This data was used to inform those. I also hope that this data will be used for funding and grant writing purposes in the future, as well as to inform future partnerships. I learned so much from this project. I'm thankful for Adventist Health White Memorial, the Randall Lewis Health and Policy Fellowship, and Cal State LA for the incredible opportunity to learn about data collection, data analysis, and program evaluation. I also learned how to use tools such as SPSS and ArcGIS during this time, which proved invaluable to me. Moreover, I learned life lessons. I learned what it means to be trusted by community members. I learned about humility and respect. And more than anything, I learned about how to be an accomplice and ally to people in the food justice world. Again, I'm very grateful for this opportunity, and I thank you all for listening.
Hello, everyone. My name is Jane Lamp, and I am a second-year graduate student at USC pursuing my master's degree in public health. I had the pleasure of working with SCAG as an Environmental Justice and Public Health Fellow, and today I would like to present my project on promoting health equity with an environmental justice toolbox. We already know that climate change and pollution impacts all communities in California, but disadvantaged communities can potentially suffer disproportionately higher adverse impacts when environmental justice, or EJ for short, is not considered during the planning process. Low-income and minority populations are more likely found living in subpar housing closer to freeways, industrial sites, and airports, all things that cities rely on to run properly but have negative impacts on air and quality of life. To combat these health disparities, SCAG has developed the Environmental Justice Toolbox, which is a practical guide that local jurisdictions or community-based organizations can use for planning and decision-making purposes for their communities within the SCAG region. It presents recommendations organized into 9 EJ topics that may inspire strategic planning and implementation of projects or policies to support disadvantaged communities. These recommendations were identified through a review of literature, recent planning activities, and input from stakeholders as part of the EJ outreach process. The toolbox is meant to be a dynamic resource that will continue to be updated on an ongoing basis to ensure the recommended practices and approaches remain relevant and accurate. In addition to the toolbox, we have also created a handout, presentation, and story map, which can be found on SCAG's website. I hope that the toolbox is informational and helpful and can support local jurisdictions and community members during their planning and decision-making processes. To conclude, I would like to thank the Randall Lewis Health and Policy Fellowship for giving me the opportunity to work with SCAG, as well as all my colleagues at SCAG who offered me so much support as I navigated through my work. Thank you for your time and attention.
Good evening, everyone. My name is Joyce Parra-Eco, and I'm a Master's of Public Health candidate at Cal State LA with an emphasis on urban community health. Throughout my time with Randall Lewis, I served as a fellow at Jamboree Housing. Jamboree is a leading nonprofit developer that seeks to deliver high-quality, affordable housing and services that transform lives and strengthen communities throughout California. Jamboree prides itself in providing more than a shelter, but homes that give every resident the opportunity to break the cycle of homelessness and live in a strong, healthy, and sustainable community through permanent supportive housing. So what is permanent supportive housing? It's an intervention that combines affordable housing with comprehensive supportive services. Permanent supportive housing is the sustainable approach to keeping families housed because housing plays an essential role for human and community development. Considering this, part of the cost of supportive housing can be offset by relieving the cost of burden of homeless adults with disabilities on public health systems of care. Jamboree is unique in that they centralize their approach based on 6 social determinants of health, as you can see in the figure of positive permanent supportive housing outcomes. My role at Jamboree was to assist with the program implementation and evaluation. This includes assisting with drafting program models, drafting an annual calendar of events, update performance metrics, and run qualitative and quantitative data outcomes. You can see the Jamboree calendar of events for 2021 that includes monthly themes and activities to keep our residents engaged and connected to their community. Another big data collection opportunity is our quality of life survey. For our promotional flyer, we decided to emphasize how much Jamboree cares about the residents by asking, "How are you really?" We also made it simple for residents to take the quick survey by including a QR code that they can scan from their phones. Considering the projects and initiatives, I had the pleasure of taking part of giving recommended practices and approaches from a public health perspective. First, an annual review of all program models and performance metrics. Second is to identify any areas of improvement. This includes which goals require more attention, such as implementing more workshops that encourage community connectedness. Third is to standardize a procedure for future assessments. An example of this is to revise survey questions to ensure that they are hitting specific social determinants of health and staying consistent for data analysis. This solidifies assessment formats and gives opportunity for Jamboree staff to track trends over time. Last recommendation is to report findings and share results with shareholders and Jamboree residents. This is made in a one-page of recommendation and infographics that share the success stories of residents. This also gives equal ownership of the data to the community and full transparency to remain rapport. All these projects have painted a picture of the impact Jamboree has made and continues to make. Jamboree is truly connected to their residents and have personal relationships within their community and partners. From the bottom of my heart, thank you Randall Lewis Health Policy Fellowship for giving me the opportunity to serve throughout this time. And thank you Jamboree Housing and my preceptor Danielle Lattery for taking me under your wing and giving me the support needed to continue keeping families housed.
Hello, thank you for joining me today. This past year, I got to work with Upland Unified School District in their Nutrition Services Department. The department is made up of a team of food and nutrition professionals that are dedicated to students' health and well-being. My specific task and goal this year was to help out in the health campaign. I didn't just have one task and one goal, but it was several mini projects. First being that I got the privilege to build a greenhouse on one of their campuses. The students get to explore and learn about plants and vegetables that are grown in regulated climate conditions. It was super interesting to build and definitely hard, but really rewarding. Secondly, I worked on distributing and providing meals to about 2,200 students during this pandemic. Upland Unified takes pride in having on-campus gardens where we grow our own vegetables that eventually land up in the meals that we provide for the students. This whole process is such an experience. We go to the garden, we pick the vegetables out, and then we clean and make sure that it's safe for the students to consume, and then we distribute it in the meal plans in our Grab and Grow program. It was really rewarding, and it was an experience that I forever will cherish, and I leave this fellowship much more knowledgeable about what lengths the school district takes to provide for their students.
Hi, my name is Kayla Armijo. I am a graduate student of University of La Verne, and I am working with the City of Santa Ana in their Public Works Department. I was given the task to come up with an implementation plan for a micromobility program. Micromobility is lightweight transportation devices designed for individual use and has great environmental impacts. By implementing a micromobility program, the city would be able to bridge the gap with public transportation by increasing alternative transportation options, reduce the amount of cars on the road, and lower the city's environmental footprint. Creating an implementation plan gives the city a guideline to follow on the different steps that need to be completed, going from planning, analyzing, designing, validation, and deployment. Going through each phase, the city will be able to complete all the necessary steps to ensure that nothing was missed and allow for successful deployment. I wanted to make sure that Santa Ana had an easy process to getting a micromobility program in action. It was also important that all legalities were covered in the ordinances and regulations, and that they would not uncover any problems during the deployment phase. But of course, there's always room for improvement, which I mentioned in the plan as well, ensuring that the plan be revisited every so often to make improvements and adjustments that would lead to a more efficient program. Hopefully, with this implementation plan, the City of Santa Ana will be able to create a micromobility program that has a huge impact for the city and its community.
Hello everyone, my name is Kevin Alvillar, currently at California Baptist University, Masters of Public Health with a concentration in Health Policy and Administration candidate. As a Randall Lewis Health and Policy Fellow, I was partnered with the County of San Bernardino under the Department of Community Vital Signs Initiative. With the guidance of my preceptor, Dory Baez, and my mentor, Tap Okwanko, I was able to get the first-hand experience in public health with the county. Community Vital Signs Initiative is also known as Vital Signs, is a community framework that aims to improve the wellness element under the county-wide vision. Vital Signs has identified 4 priority areas, which are economy, education, health and wellness, and safety. These priority areas are critical to mitigate the social determinants of health and improve the overall wellness of the community. The unprecedented COVID-19 pandemic affected everyone. Therefore, we knew that it was very critical for us to create a health equity assessment survey to better understand the COVID-19 impact on the community. I referenced the Barhai Toolkit and also partner surveys to create a condensed 12 questionnaire survey. These results provided us a better understanding of how COVID-19 impacted the 4 priority areas. Some of the important results that caught my attention was the fact that there was high unemployment rates, and those people that were still currently employed, they had a higher workload. There was a high demand for childcare. In addition, when it came to the safety aspect, there is that lack of trust between the community and the government. The results of these assessment will guide the steering committee to strategically create the transformation plan to better improve the overall wellness of the community and build the resilience of San Bernardino County. Thank you.
Hello, my name is Mackenzie Orr, and I am a 2021 Randall Lewis Health and Policy Fellow. I currently attend California Baptist University, where I am obtaining my Master of Public Health with a concentration in Health Education and Promotion. For this fellowship, the site I was placed at was the city of Montclair. One project we worked on throughout my fellowship focused on senior nutrition. It is estimated that approximately 50% of senior citizens do not get adequate nutrition every single day. In order to combat this problem, the city of Montclair has offered free meals for senior citizens throughout Montclair, and they are distributed at the Montclair Senior Center. In light of the COVID-19 pandemic, people cannot gather together. And in order to make sure that the seniors can still get their meals, the Senior Center distributes these meals curbside, so these seniors can still make sure that they get delicious and nutritious meals every single day. For this project, we collected survey samples from the participants of this program and analyzed the results. We were able to get information of their demographics, including their race and ethnicity, their gender, their marital status, the languages they spoke, education level, and so much more. We were also able to gauge their happiness with the nutrition program. We were able to see what they liked about the program, what meals they liked, what meals they disliked, if they found the site to be clean, and then also we were able to gauge their enjoyment of the presentations that are offered at the Montclair Senior Center. We were also further able to gauge what programs and presentations these seniors would like to see moving forward at the Senior Center. This program is very valuable to our senior residents in the city of Montclair, and it was a pleasure to be able to analyze the data and learn more about this program.
Hello, my name is Mary Darmov-Sassian, and I am a Master's of Public Health student at Azusa Pacific University. I am due to graduate this May, and I was involved in a research project with my preceptor, Dr. Teresa Dodd Butera from Azusa Pacific University. I specifically focused on carbon monoxide poisoning in pregnant women. I was interested in learning and understanding maternal fetal dyad morbidity and mortality and their related outcomes from carbon monoxide poisoning. I researched and gathered data from Poison Control Center's annual reports going back to 1999. In addition, I conducted a scoping review, and the results I used to further analyze and synthesize these articles for concluding outcomes, as well as policies and educational tools in preventing such poisonings. It has been an incredible learning journey for me, and I'm grateful for Randall Lewis Health Policy and Fellowship, as well as my preceptor, Dr. Teresa Dodd Butera, for this opportunity, mentorship, time, and effort that has been invested in me and my educational journey. Thank you.
Hello, my name is Michael Seeley. I am a Master of Public Policy student at the University of California, Riverside and a fellow at the City of Eastvale. The City of Eastvale is among California's youngest cities. Incorporated in 2010, the City of Eastvale has a unique opportunity to lay the foundation of a great American city using 21st century methods. Located along the westernmost boundary of Riverside County, between some of the busiest freeways in the nation, greenhouse gas emissions are a growing concern for the city. Using a grant from CAL FIRE, I have been working with the City of Eastvale to develop an urban forestry plan to plant 350 new trees in the most polluted parts of the city, thereby removing nearly 1.7 million metric tons of CO2 from the air. My work has also included renewing the city's Tree City USA designation from the Arbor Day Foundation and researching how cities across the Inland Empire have developed their urban forests and sustainable practices. Trees are often a defining characteristic for cities. They build community identity and establish a connection between the urban and natural environments. In older cities, such as nearby Riverside, the trees that line city streets give the community charm and character. These 350 new trees will become part of Eastvale's identity, growing with the city for generations to come and alleviating the burden of increased pollution as the Inland Empire's population grows. By taking steps now, this will make future mitigation efforts easier as issues such as climate change become reality. I would like to thank the Randall Lewis Fellowship and the City of Eastvale for this wonderful opportunity to serve such a dynamic and growing city. Thank you.
Hello everyone, my name is Michelle Sheen and I'm a second-year Masters of Public Policy student at the University of California, Riverside. I have been placed with RODA, or the Riverside Overdose Data to Action, under the Riverside University Health Systems, and working here has been a really wonderful and insightful experience. The major project I was assigned was to draft RODA's strategic plan. The plan is going to be in effect for approximately 3 years, and its purpose is to help identify goals RODA wishes to meet, among other important information. The 4 main goals all pertain to different aspects in Riverside County. The first is to prevent substance abuse. The second is harm reduction, or to address those already affected by prescription and illegal drugs. The third is to empower Riverside County residents, and the last is to effectively release data to the community. The strategic plan also includes several strategies established by RODA, as well as activities the organization has been doing to fulfill those strategies. There's data present to connect overdose data trends in Riverside County, as well as surveys that ask internal public health organizations their understanding of overdose resources. Overall, the plan has been challenging but rewarding to complete. After several drafts and overview, I'm very excited to see my contribution to the organization. Some policy recommendations I would have are to strengthen educational resources in primary schools and governmental organizations relevant to drug abuse and drug misuse within Riverside County. I also think it's quite important to create access to care facilities and resources such as naloxone in private and public areas. Thank you very much for listening, and thank you, Randall Lewis, for this opportunity.
Hello, my name is Master Miles. I am a student at the University of Laverne. I'm getting my Master's of Healthcare Administration with an emphasis in public health and health equity. The side I'm at is Racism as a Public Health Crisis. And so just a small overview of my project, I'm actually creating a toolkit that promotes health equity and racial equity within Riverside County and San Bernardino County. The biggest thing that I wanted to do was address the socio and ethnic demographics of San Bernardino County and Riverside County and see what the need was there. And so through this toolkit, I have created a checklist along with a few other things that are able to help cities and organizations combat racism, medical racism, and inequities within their city. And so my biggest thing is every human deserves the divine right to life and should not be systematically removed from quality healthcare, housing, or access to healthy food due to the color of their skin or ethnic origin. And so with this, we have the initiative Racism as a Public Health Crisis. The objective of my toolkit was to be able to guide organizations in Riverside County and San Bernardino County into creating health equity and racial equity models for organizations that combat racism at an institutional level. And so toolkit, I made sure to check all the bases and look at educational attainment, socioeconomic demographics as well, such as the average household income. And I wanted to take that into play when we're looking at this because I'm doing it from a social determinants of health lens. And so you want to understand what the need is in Riverside County and San Bernardino County. And so for that, I also wanted to address, again, mostly racism within this county, but I wanted to also talk about mental health and the stigma associated with that with communities of color and Black people. And so my studies are more so focused on the Black community because it's one that I'm a part of and one that I'm very passionate about. But I also did want to include people of color within my toolkit because it's important to service. Poster, I only showed San Bernardino County because of lack of space. It is also quite similar for Riverside County, but for me, I wanted to focus on minorities and Black people and people of color because I think it's important because they're the most overlooked. And thank you for looking at my poster, and I hope you enjoyed it.
My name is Natalie Giselle Morales Sandoval, and I'm a second-year Master's in Public Policy student at UCR, and I have been working at the Healthy Fontana program. The project I have been working on is identifying the social determinants of health and community involvement for the program. With the guidance of my preceptor, Jasmine Sarsavillas, the 5 social determinants of health were analyzed through online surveys and virtual interviews to active and non-active Healthy Fontana participants, as well as community members and local stakeholders. We received a total of 103 responses by sending out a flyer, which is at the bottom of this poster, in both English and Spanish, to the Healthy Fontana contact list, local stakeholders, and other organizations. The results in the green table show that non-active Healthy Fontana participants have low social determinants of health, which show that social determinants of health do affect the community involvement. The pie chart shows that 32% of our respondents have health concerns, which shows that there are still issues in their community regarding health. The spatial analysis conducted show that the most impactful social determinants of health are economic stability and neighborhood and built environment because they overlap in areas of the city where health concerns are higher. A recommendation from the qualitative responses is to increase the social connection through the walking program in the neighborhood, which demonstrates that the importance of neighborhood connection. Overall, the project shows that social determinants of health do affect the residents' health and community involvement. Therefore, the recommendation is to increase socialization efforts to strengthen the healthy community involvement.
My name is Priya Metanat. I'm a graduate student from Claremont Graduate University, and I study public health. Randall and Lewis Fellowship Program gave me the opportunity to work in Public Works Department of the City of Riverside, and the projects that I was primarily involved in were formed around the city's comprehensive active transportation plan. An active transportation plan, which typically includes enhancement of a sidewalk and bikeway network, is a well-established public health tool that improves quality of life and health in the communities. And this plan specifically utilizes geographical and spatial analysis, which have the safety, health, accessibility, social responsibility, and environmental stewardship throughout the city in mind. And the map shown in the poster is actually an example of safety analysis, which shows collision hotspots throughout the city, which involved pedestrian or biker. A similar analysis provided a priority framework for the city's future active transportation plan. Thank you for your time, and I hope you found this project impactful.
Hi everyone, my name is Reina Peña Calvillo. I am a second year MPP student at UC Riverside. Over the last 8 months, I have had the opportunity to be placed and work with Jamboree Housing. The work I have done with Jamboree consists of evaluating certain aspects of the Children's Behavioral Health Peer Navigation Collaboration Program. The program is made possible by a grant funded by CalOptima and is in collaboration with the Children's Guidance Center. One of the objectives of my project is to implement evaluation tools to educate and enhance the residents' quality of life. In order to identify any gaps in the community and to be able to enhance the lives of residents living at Jamboree's Clark Commons location, as well as the surrounding community, I developed surveys to collect data and analyze various services and programs provided by Jamboree and their community partners. I also interacted with the community by joining in on multiple virtual community meetings, workshops, and programming to get a better understanding of what the needs and wants of the community are, and also be able to identify any existing gaps. Through that, in April, I was able to bring in various community partners to Jamboree's weekly community meetings to help